Let's remember the signs and symptoms of infective endocarditis using the mnemonic Endocarditis. E stands for embolic phenomena. Tiny infected clots break off from the heart valves and travel through the bloodstream, causing stroke, splinter hemorrhages, or Janeway lesions on the hands and feet. N is for new or changing heart murmur. As the heart valves become damaged, you can hear turbulent blood flow, a key clinical sign. D stands for dyspnea and heart failure symptoms. When the valves fail to close properly, the patient may feel breathless, weak, and fatigued due to reduced cardiac output. O reminds us of Osler's nodes, which are painful red nodules found on the fingers or toes, a classic immune response finding. C stands for chills and fever, often intermittent but persistent, due to continuous infection in the bloodstream. A is for anemia of chronic disease, caused by long-term inflammation and destruction of red blood cells. R stands for Roth spots, which are small retinal hemorrhages with pale centers, seen on eye examination. Another immune-mediated sign. D again reminds us of digital clubbing, where the fingertips become rounded and bulbous, often seen in long-standing cases. I is for increased ESR and CRP levels, laboratory markers that show active infection and inflammation. T stands for tender spleen or splenomegaly, caused by immune or embolic involvement of the spleen. I again stands for immune phenomena, like glomerulonephritis and vasculitis, which can affect the kidneys and small blood vessels. And finally, S stands for splinter hemorrhages and septic emboli, those tiny linear reddish streaks under the nails that suggest systemic embolization. So, to sum it up, endocarditis helps us remember that this condition affects not only the heart valves, but also produces widespread immune and embolic effects throughout the body. Always think of fever, new murmur, and peripheral stigmata as key clues. Early recognition and prompt treatment can save the patient's heart and their life.